In late January 2024, U.S. health officials issued an emergency warning to be on alert for cases of measles following outbreaks in several states, largely among children who did not get vaccinated. Viruses such as measles, smallpox, and polio are virtually non-existent in many countries thanks to vaccination efforts over time. But new data shows one group has seen a drop in vaccines: children, especially those in kindergarten.
A report from the CDC reveals that state-required vaccines among kindergarten students fell to 93% during the 2021-22 school year, a decline for the second straight year. Health experts link this drop in childhood immunizations to a decline in vaccine confidence stemming from misinformation circulated during the COVID-19 pandemic.
The CDC and frontline healthcare providers are now fighting to get young patients back on track, starting with building back trust. Savannah Billiot always knew she wanted a full house.
Growing up, I always wanted 4 kids. I was like, I want 4, I'm gonna stop at 4. And I did it.
Got a bonus kid.
More, yeah. And then animals, I love them all.
Holding true to her Native American heritage, she gives her 5 children some of the same natural remedies passed down in her family through generations.
Children. I make the kids medicine. We do olive oil, lemon, and honey. We mix that up, warm it up, and that helps with so much of their stuff.
And her family doesn't shy away from germs.
We always say, we're the family who likes germs,
but rather trust their immune systems to fight back. This mom, who once fully immunized her kids since birth, is now saying no, opting out of childhood vaccines after the COVID-19 pandemic.
I just put a stop to it. And I knew a lot of people that have never vaccinated their kids, or who have and then stopped vaccinating, and so I stopped completely.
And why did you stop?
Because of the push of COVID. It was too new. And the way that it was being pushed and the way all of it was being done, with even testing for COVID, it was being pushed too hard.
Savannah is part of a growing number of parents opting out of getting state-required vaccines for their children. According to the CDC, doses of the MMR, the measles, mumps, and rubella vaccine, DTaP to fight diphtheria, tetanus, and pertussis, the poliovirus vaccine, and chickenpox vaccine all decreased among kindergartners for the 2021-2022 school year to 93%, a slight drop from the previous year's 94%. It's a trend that has state and national health leaders concerned.
But when you think about it, that's about 1 in 14 kindergartners who is not up to date on their vaccines. And to me, that's troubling to see this trend.
Dr. Deborah Howry is Chief Medical Officer for the CDC. She says the CDC's Let's Rise initiative is a push to get everyone back on schedule after a drop in vaccinations during the COVID-19 pandemic.
So there's many different ways we get this information out. One is through, talking to the public through media interviews or other outlets. The other is working with pediatricians,
who say there's a lot more hesitancy today when discussing vaccinations with parents than before the pandemic.
Are you having to spend more time with your parents on discussions about vaccines?
Absolutely, absolutely. Definitely since the pandemic and, a lot of the politics surrounding the COVID vaccines and the mandates for this and the mandates for that, and people start to question the system.
Pediatricians Dr. Henry Pelche and Dr. Kenneth Cruz work together caring for children at their clinic in Thibodaux, Louisiana. They're working as a team to dispel myths and misconceptions about childhood immunizations.
What we try and do in our job all the time, because there's a lot of emotion in parenting, is to help objectify things, calm things down, and allow people to make clear decisions.
Because ultimately, the decision to vaccinate or not to vaccinate each child falls on the parents. But the consequences of not vaccinating may have a broader impact on entire communities. According to JAMA Network, herd immunity occurs when a significant portion of a population gains immunity to an infectious disease, indirectly protecting those who are not immune. As Michigan State Medical Executive Dr. Natasha Bagdasarian explains, achieving herd immunity can be tricky.
It varies depending on which disease we're talking about. When we talk about measles, for example, that's something that is highly transmissible. Measles is something that is not only transmitted by people who are near you and in the same room, it can even be transmitted by particles in the air 15 minutes after an individual has left a room. So when you're talking about something that is as transmissible as measles, really the more people who are vaccinated, the better.
According to the Mayo Clinic, when it comes to measles, 94% of the population must be immune to the virus to interrupt the chain of transmission and achieve herd immunity. The CDC report puts the kindergartner survey just below at 93%.
So take a look at what's happening around us. We've actually seen an increase in global measles cases over the last several years. And so as our immunity, as our herd immunity goes down in many parts of the country, and as globally there are more cases of these diseases, and people are now resuming global travel, we all are at more risk.
Healthcare leaders we spoke to say the prescription for reducing that risk can only come from increased communication and building back trust.
If we as public health are providing information that is scientifically accurate, but people don't trust our messaging, that's a real problem.
I think we have to respect the dialogue again. And I think that was part of the damage that has been in many fields, not just medicine, but I do think the dialogue has been damaged, and there's so much to learn from dialogue.
As for Savannah, more discussion about vaccines is not likely to change her mind.
I think that'd be very beneficial to other parents making that decision.
Do you think that some vaccines are purposefully put out there to harm you?
I don't. I think for the most part, they're out here trying their best like the rest of us, but it's just not for us.
Savannah says that she and her family still go to the doctor and take medicine as needed, just not vaccines. Dr. Bagdasarian adds that the healthcare system is a victim of its own success because people don't remember how bad diseases such as polio, smallpox, and measles truly were, so there's hesitation to keep fighting against them.